When patients ask me if they're a candidate for weight loss surgery, the first thing that I think about is the risk of surgery worth the benefit that they're going to gain from losing weight? And for most patients that are over even 50 pounds or so over their ideal weight, the answer to that is yes. A lot of it depends on which procedure they're looking for as well. For instance, the intragastric balloon has almost no risk to the patient, or very minimal risk. So even if you're looking at losing 20 to 30 pounds, it may be worth pursuing that just because the risk is so low. If you're looking at a more involved procedure such as a gastric bypass, you may need to lose more weight in order to tolerate the risk of a major operation. If we're dealing with an insurance plan that is going to cover the operation, then those criteria are much more strict. So the patient has to meet the criteria of being probably at least 50 to 75 pounds over their ideal weight if we're going to meet the insurance qualifications. But most insurance plans now do provide some type of coverage for different degrees of obesity, and we can specifically look at what insurance plan you have when we see you in the office. When patients ask me what type of surgery that I feel is best for them, I don't like to look at a patient and pick their surgery for them. I see my goal as the physician is to educate the patient, let them know what options are out there, and to make sure they have accurate information to help make the decision that's best for them. As long as they're using correct information, then I'll work with them if I feel that that's an appropriate choice for them. For instance, if a patient is diabetic and needs to lose weight more quickly because of the degree of their diabetes or health problems, then I may steer the patient more towards a more aggressive operation like a sleeve gastrectomy or a gastric bypass. If a patient has a lower amount of weight to lose or needs to get back to work very quickly or is unable to take much time off of work, they may want a less aggressive surgery like a lap band or even a gastric balloon, where they can get back to work very, very quickly with very minimal downtime. Different people want to have surgery for different reasons. They may be afraid to have surgery for different reasons. So I just want to make sure they know all of the options that are available for them, and I will help them pick which operation they're comfortable with. And when I'm helping people decide which operation is best for them, I also make sure that they're using accurate information on current technology and techniques. A lot of people will have something in the back of their mind. Well, I have a friend who had a bad complication with a gastric bypass years ago, and I'm still concerned about that. You have to realize now that the technology is better, the techniques are better, our post-operative care is better, which has really decreased the surgical complication rates with all the procedures across the board, and they're much safer than they've ever been before. When patients are worried about the weight coming back, what I want them to realize is that this is a long-term journey. This is a tool that I want them to have for the rest of their life. We're not trying to see how much weight they can lose in the first 6 months or the first year, because I want this to fit in with their lifestyle, that they're going to learn to use it and enjoy having it with them for the rest of their life. It's not something that they need to go into thinking this is going to be reversible, we're going to take it out, we're going to change it. And if you go into it with that thought process that this is a tool I'm going to have forever and it's going to help me for the rest of my life, then we're not looking at this yo-yo diet as you gain weight, lose weight, gain it and lose it like it's been in the years past. This is a new lifestyle, it's going to be the new you, and you're going to be better and healthier for it in the long run.